Hi guys, good morning. Let's get ready for a 12-hour shift as a CNA in the hospital. Today I'm working 7A to 7P, and the hospital that I am going to is about 33 minutes away from my house. And I will be going into two different departments today. I will be a constant observer for the first 8 hours of my shift. And then for the last 4, I will be going to the surgery trauma ICU. When I'm assigned to be a constant observer, it's just a fancy term for sitting with a patient, and you can be sitting with a patient for a number of reasons: safety, SI, HI, psych. You could be there to watch the patient, you could be there to watch the family members, friends, visitors, whatever the nurses and the doctors see that is an issue, that is what you would be watching out for. You have to keep your eyes on the patient at all times. It's not really a fun job, but it's a necessary job. I personally find it very difficult to sit in one spot for a long period of time. I get bored very easily, and I have to be moving around, and so it's just, some people thrive sitting. I do not thrive being a sitter. And then at 3 p.m. I will be going to, like I said, the STICU. There, it's just more of a secretarial position. You are in charge of getting the patient's blood sugars. You're to help with baths. You're to help with your Q2 turns, the pulling up in bed. But the majority of the patient care does fall on the nurse, since these patients are just a little bit more sick and require more attention and more medication. The nurses take the brunt of all of the patient care. But that is not to say that it is not busy, because yes, you aren't responsible for a lot of the care that goes on. You